The whole premise behind the CARAT project is to help people that are uninsured, underinsured, or on government programs of Medicaid and Medicare to acquire the items they need, the walkers, the wheelchairs, canes, quad canes, forearm crutches that they cannot afford.
We brought in used equipment, we have cleaned them, we've replaced parts. I come from a rural town, so it feels good to be able to give back to those who have provided for me. It just feels good to know that we are helping to improve someone's quality of life.
It's very rewarding. I feel like we're doing something that matters.
Project CARAT began in May 2012 with a $450,000 federal grant. Partners include the State Vocational Rehab Office, the Bluegrass Technology Center, and the CARAT Project based at the University of Kentucky.
A lot of people in Appalachian, Kentucky don't have access to the health insurance and things like that that might pay for some of this equipment otherwise. Or even if they do have health insurance, they might not be able to afford the copay that comes with the equipment.
If you're talking Medicare, Medicaid, it could be months of trying to be in the system before you can actually get the equipment.
Right now, when Medicaid purchases a piece of equipment, when the person stops using it, goes in a landfill, gets tucked in somebody's closet, it is not usable by anybody else.
So this will have a huge cost savings both to the state, to the insurance companies, but also to the individuals who just need equipment quickly.
We are accepting all types of assistive technology and specifically the home medical equipment.
Mostly what we've been bringing in is wheelchairs, walkers, canes.
The first equipment that was donated was 5 hospital beds, and it took us 2 days to get them flipped out into people who needed them.
CARAT is an NIH-funded project to support people in Eastern Kentucky returning home after stroke, brain, or spinal cord injuries. The Center for Excellence in Rural Health and Hazard is one of CARAT's many partners.
Part of what the CARAT project is doing is we're providing our linkages within the community to get the word out, to find the durable medical goods, assistive technology.
A lot of the health providers are saying there is a need for this program, and a lot of them want to know more information and want to become partners in this program.
The CATS Network here in Kentucky is rolling out a new online database. The CARAT project has our own inventory so that folks can explore the items we have readily available and make a request online.
The AT recycling is done across the United States, and Medicaid equipment recycling is done in a few places. But nowhere are they using this service learning type of model that we are using here in Kentucky.
We're going to know how to fix the equipment ourselves if problems arise while we're with patients. Dr. Kitzman's already told us about things that he's gone through as a physical therapist himself and how he's had to make those minor adjustments whenever he was working with patients.
I mean, this is a skill set you need. You absolutely need to be able to fix things because you're always doing it on the fly.
The students really get to learn hands-on about assistive technology and how it works and what's available and how it gets assigned to people. So it will actually make those students better clinicians in the future.
I definitely think it'll help us in our physical therapy career. We deal with assistive devices, so we need to know how to take care of these devices, and we need to teach our patients how to care for these devices as well.
And our students are passionate about trying to give back, especially our students who are based out of Hazard are all from rural communities. So they get to have a direct impact in their own communities, which is an awesome feeling.
Providing them a hands-on opportunity in a learning environment, but also a giving back environment to the community, we believe is a win-win-win situation for everybody involved.